You know, we can afford stadiums, we can afford tunnels, we certainly can afford to deliver health care, especially to those most in need.
In 2009, Jackson Health System was in major financial trouble. Years of inefficient management had taken their toll on the crown jewel of Miami's public health system. Political forces maneuvered to take advantage of the crisis by steering the public hospital into private sector management. The vultures circled, waiting for their chance to rip apart Jackson and sell its pieces to the highest bidder. Jackson had entered the darkest period in its 90-plus year history.
We see in the paper every day, things are fine, the ship has been righted, the books are balanced. Things are not fine.
There are box loads of people who are being denied care at Jackson because they do not have the cash to put down on the table. This is not right.
The mission, let's remind ourselves, is one single higher standard of care for everybody in the community, regardless of ability to pay.
For nearly 3 years, all that stood between Jackson and the wholesale dismantling of its public mandate were the nurses, doctors, and healthcare professionals who fought to save the hospital they loved.
We all know what the answers are. The implementation is what is missing. You on the other side of the table are in charge of implementation, and we need you to do your job.
Led by longtime trauma center nurse manager Martha Baker, RN, and a corps of leaders from every unit in the hospital, SEIU Local 1991 waged trench warfare against politicians, captains of industry, and a shadowy group of influential people pulling strings behind the scenes. This is the story of how a dedicated, unionized workforce took on the system in order to save it. This is how the union won.